All right, people. Good evening, everyone. My name is Ruben Ojo, and of course, I'm your host for Everything Health Education on YouTube. Tonight is a special night, and I will be starting a new series on violence prevention, which is a new area of interest to me now. I mean, a few people around me would understand that. So I will be doing a three-part series on violence education. We'll be starting tonight. And by the way, it's evening here. So once again, good evening, everyone. And this series is not going to take long. It's probably going to be around 35 minutes just to shed some light on some of the things that are public health related. However, most times we tend not to look into these things as public health, right? So tonight, I'm going to start a series on violence prevention. And of course, on the very last episode, I will be bringing on a specialist, to wrap up this thing and bring us some experiential experience, the field experience, hands-on experience she's had in years past, and we can all learn from that as well. So this video is for everyone, not just for public health professionals, not just for health education educators to say, it's for absolutely everyone. So I'm gonna start sharing my screen so we can actually begin. All right. I believe everyone can see my screen. And we are on public health and violence prevention. All right? Public health and violence prevention. So we all know what public health is. And if you don't know, one thing I love to say to people is this is the aspect of health that has to do with the general population. I love to say to people, public health is a direct opposite of individual health. So when you talk about public health, you talk about health promotion, health education, the well-being of a target population, all right? The well-being of a target population and things like that. All right, so let's begin. So the outline tonight will be just very few in four parts. Public health and violence prevention. What are the types of violence in public health? Now, what is the public health approach to violence prevention? What can we take away from that study? And of course, the last part is going to be summary. And of course, we have the part two series, the part two series in a few weeks' time. All right. So let's begin like this. I'm excited. All right. So now, what is the relationship between public health and violence prevention? Now, let's start by defining violence. Violence is any behavior that involves physical force intended to hurt, to damage, or to kill someone. So violence, it can be in different paths. Whatever you do to another person that damages them emotionally, that damages them physically, and has the ability of causing their death, right? So that is violence. And this is one of the things I have battled with over the years. Like, why is it that we make gun violence a public health issue? Why is it that we make rape a public health issue? These are things that we can actually term as social issues, right? However, how do they factor in to become a part of public health? And I'm going to explain the relationship between public health and violence in three different ways. All right, in three different ways. So, violence is an urgent public health problem, and I've made this basis on three terms. All right. So, the first one is a shift in the cause of death. In the 20th century, in the 1950s and up to the 1970s, we will have the disease killing people as, for example, in Africa, where I'm from, we have disease killing children as polio. We have disease killing people as pneumonia. We still have the disease killing people as malaria. All right. So these are not things that health education would naturally solve. All right. So, but if you look at the disease shift, all right, in the causes and the etiology of diseases, there has now been a shift from where we believe that health education has a lot to do with the treatment. I mean, in 1950s, who would think we could use health education to prevent polio? Who could think we can use health education to prevent pneumonia? Or rather, the thinking and the focus of the health sector was not in that direction. And so, in other words, when we're talking about things like violence prevention, which happens to be one of the things we'll consider now behavioral health, health education comes in handy as one of those ways to reach out to people to be able to reduce the number of incidences that we have in this place. All right. So another one is the importance of behavioral factors in the etiology and prevention of diseases. Now, we all know what, some of us know what epidemiology is, which is all about the occurrence of diseases, where it happens, how it happens, when it happens, and things like that, the four W's, right? So, what is the importance of behavioral factors in the prevention of disease? And this is one of the places we can draw a connection between public health and violence prevention. So think about this as an example. We have our rape victims, and someone might be thinking this has nothing to do with public health. But the thing is, rape victims eventually will suffer from mental health diseases or mental health disorders. That is a part of public health. Rape victims eventually, we've seen a number of morbid cases from here where people die from these assaults. And of course, once it comes to death, has to do with death numbers and those things, obviously affect the public health. And of course, I think one other thing that we often miss out when we talk about public health is the economic cost factor. The public health is funded by taxpayers' money. It is funded by the government. We need grants. We need funding to tackle the public health, to tackle the health of a region, to tackle the health of a country. All right. So again, these are some of the bases that we can say violence prevention. Gun violence leads to a large number of deaths annually. Rape, assault leads to a large number of deaths. Elderly abuse and things like this. So it is easy to not understand, and of course to try and say this is not a part of public health. But again, if we look at the paradigm shift in the causes of death, if we look at homicide and suicide reaching epidemic proportions, all right, which are all linked to behavioral factors, the behavioral health of individuals, all right? So the goal of public health or violence prevention is to decrease risk factors and increase protective factors, which is one of the things I will be talking about later on during the slides. Okay, so quickly, what are the types of violence? Number one, you have the community violence prevention. Number two, you have the sexual violence prevention, which could be as a result of rape. It could even be as a result of legal intimate partners. Rape still occurs in those circumstances. All right. So we can also have child abuse and neglect prevention. We can also have elder abuse prevention. We can have the firearm violence prevention, which is a big deal in the United States, and it's becoming something of endemic proportions in the world. All right. So you can also have coping with stress and adverse childhood experiences. So one thing I'm going to say is all this kind of violence acts, all right, the mode of prevention is peculiar to each one of them. All right, so you may not find three of these violences having the same mode of prevention. It will be different from the different types to different types because the causes are different, the risk factors are different, the predisposing factors are different. So obviously the prevention will also be different in some cases, all right? In some cases. All right, so what is the public health approach to violence prevention? we've been able to establish a relationship between violence and public health based on the number of deaths we are seeing, based on the shift in the causes of death that we are now seeing. Deaths used to be much more clinical 20, 30, 40 years ago. However, now we are seeing suicides. It's not clinical. It's something that has to do with mental health. It's something that has to do with health education. So there is a shift there, and that falls under the jurisdiction of public health. All right, so the public health approach asks fundamental questions. So I've often said to people, public health is not an invasive health model. It's not invasive. Invasive in terms of it's not clinical. We are not running tests. We are not doing diagnostics, all right? Those things we are not doing. However, some of the things public health will seek to address will come in form of questions like, where does a problem begin from? Now, if you're a student of epidemiology and you are familiar with the story of Jon Snow, this was the first question it tackled. Where did this disease begin spreading from? What is the origin? All right, what is the origin? How could we prevent it from occurring in the first place? And to answer these questions, we use a four-phased model in public health, which is called the public health approach model, to answer these questions, and I will be going into them shortly. All right, so the four steps. Now, the first part of this step, which is step one, is data collection. So if you have a violence happening, for example, I'm in Contra Costa County, all right? So if you have violence happening in Contra Costa County, it's happened, the incidence rate is becoming unbearable, higher than the usual numbers, all right? One of the first things you want to do is to collect the data, all right? So the first thing that you want to find out is, what problem do I have to prevent? So for example, you work for an organization like CVS, Community Violence Solutions, and you have educators going to a school. Now, the first question you want to ask yourself is, what are we trying to prevent in this school? What are we bringing to the table? What is it that our strategies will be taken care of? What problem do I want to prevent? So you go to, let's say you go to Santa Clara County, and the major problem there is gun violence. So obviously, every approach you want to do there, everything you want to do, your outreaches, your events, your tabling, it's going to be tailored to gun violence. And quickly, let me just ship this in. Again, it is very possible for you to have an area, a county, and there are so many kind of violences going on at the same time. However, your approach might just be targeting just one type of violence, and that is right. And that might be based on your capabilities, based on the resources that you have, based on the funding that you have, depends on a host of factors, right? And again, you have to talk about, what are the data available to describe the scope and the burden of the problem? All right, do you have an existing data? Do you want to reinvent the wheel? Is this something that has gone on before? Is there literature review on this thing? Is there a systemic or a systematic approach that has been done before? So these are some of the things you want to put into consideration. And of course, who is experiencing this problem? What is the target population? And I'm using this word, target population, tailored materials, because these are specific things that we must know if a public health approach is going to work anywhere. Who is your target population? And what is your tailored message? Very important. All right. So who is experiencing this problem? Let's say, for example, in 5 high schools in Santa Clara County, there is high sexual assault going on in the schools. So we understand that this program is not going to be for the elderly, it's going to be for the students, and that is going to be your target population. All right, so that is important. So wasting resources, your resources is going to where it should go to, is going to who is experiencing the problem. All right, so when and where is the problem occurring? So if there is anything I'm going to say about the step one, is it is epidemiological in nature. It focuses on the epidemiology of the disease. When is it happening? Where is it happening? Why is it happening? These are the questions that only data can answer for you. And that is why it is important that the step one is data collection. All right? Data collection. So, number two, identify the risk and the protective factors. And this is where I'm going to focus for a minute. All right. So when we say identify the risk factors, what does this mean? It simply means that identify the predisposing factors. What are the risk factors in Santa Clara County that has allowed the incidence rate of sexual assault in high school to rise? What are the predisposing factors? Okay, so what are the risk factors for this problem? So, for example, one of the examples I love to use is tobacco. All right. Uh, Last year in Fresno, there was a law that was passed, the policy that was made in Fresno, Central Valley region, that smoke shops where they sell cigarettes and smokes and things like that should not be within 10 miles of school radius. And I personally think that's a great policy. All right. So we've identified the risk factor in that situation to be the proximity of smoke shop to the schools. And that was why we had high usage of tobacco among high school students. That is a risk factor. So the more you are able to eliminate your risk factors, the more the protective factors becomes predominant. And every time the protective factors are more than the risk factors, you are sure to have a good outcome. All right? You are sure to have a good outcome. So any public health approach should be heavily invested in reducing the risk factors and increasing the protective factors. I'm going to say that again. Whatever public health approach we are taking, and for whatever purpose, the goal must be to reduce the risk factors and to increase the protective factors. The protective factors is like a firewall approach. All right, put things in place that this cannot happen. So, for example, we have boys' schools and mixed schools, all right? A mixed school in a county. And we've decided that there was a data, let's say for instance, there was a data in a certain school that said in the last 10 years, this school has had PE teachers, all right? And there have been cases of sexual assault with PE teachers and the students in the last 10 years. So one of the things you want to do with that information is to try and change the hiring process. You want to try something different, and that becomes a protective factor. So every time the protective factor is increased, it tends to reduce the risk factors, which ultimately tends to reduce the number of event occurrence. That is important. All right. So number three, you want to develop and test prevention strategies. So the first one will be, where do I find information to answer what are the most effective strategies on the best available evidence? So whatever you do in public health, whatever you do in health education as an health educator, you want to go by the best practices. What are the best practices out there? All right? What are the best practices out there? Now, this is a beautiful thing about public health and health education. There is nothing particularly new, and there is the models in health education, the strategies are not new. You just need to find what applies to the problem, to the public health issue that you currently have. All right. And if it doesn't exist, let's say, for example, it doesn't exist, what do you need to do? based on what was learned in data collection, learning about the risk factors and protective factors. Now, the truth is this: the problems exist and the solutions exist as well. And this is one thing I love to say about COVID. As public health sector, we never experienced COVID before, but the production of masks came in, the usage of masks, the social distancing came in, the vaccination came in. All right. So as these things come in, there will always be strategies based on the evidences we have on ground to form a new approach. And that is why we can never overlook the role of health education in all of these things. It sets the tone. All right. It sets the tone. It sets the resources, the strategies in place. All right. So, and the last thing you want to do on the step 3 is this: is the strategy effective? Did it do what it was intended to do? And this is one thing in health education that we call fidelity. I'm going to say that again. This is one thing in health education that we call fidelity. Which simply means, did my program do what it's supposed to do? So let's say we said in a school program, we are going to distribute condoms to high school kids, all right? Just because there is a high pregnancy rate or STIs in this school. And at the time, your team of health educators felt this would be the best thing to do. Let's give them condoms to use as a preventive measure. Then when you evaluate this program after 6 months, you find out that the incident rate of STIs is just off the chart, has increased tremendously. It means that your approach has not worked, your strategy has not worked, and you're going back to the basics. All right. So fidelity is important in health education. Is my program doing what it is intended to do? That is super important. All right. And the last one in the approach is what I call adoption. And it's simply adoption because whatever evidence, whatever strategy, whatever model, health belief model, innovation theory, social belief theories, whatever model you are using in health education, you have to disseminate and implement. All right? So you've crafted a model. Your team has come up with a beautiful strategy. These strategies don't work themselves. It is your duty to implement this strategy. All right? So the first question you're asking yourself is, who would benefit from this strategy? Is it the parents? Is it the educators? Is it the policymakers? Who are we targeting with these strategies? So I gave the example of the mile radius in Fresno for smoke shop and high school. All right. So that was done to target the high school students. Most of them didn't drive to school. So our thinking was, these kids really don't want to take Uber to go buy cigarette or tobacco in the shops, right? They don't want to do that. So that was targeted towards the student. So what is your target population? That is important. That is important. As an health educator, you're going into a program, into a prevention program. The first question you want to ask yourself is, who is my target population? Absolutely important. All right. Number 2, how do I get the strategy to the people who needs it? And this is where you have to do what we call your needs assessment. Your needs assessment helps you to know what the problem is, helps you to know who does the solution belong to, helps you to also know that this solution that you are preferring must work. Your needs assessment, you gather the necessary information. And of course, I've said this in several videos, okay? That your needs assessment is something you always have to go back to. It's not just you've gathered data on what the problem is and you're done with needs assessment. No. If you move into planning, you have to review your needs assessment. If you go into implementation, into research, into evaluation, into leadership, into advocacy, which is what health education really does, you have to always understand the place of your needs assessment. Very important. All right. And of course, the last one, okay, I mentioned already, emphasis on assessment and evaluation. All right. How do you evaluate this program that you have implemented? Are you using a focus group? Are you using a Delphi technique? You decide based on the data that you have, based on the participants, the target population, and things like that. Emphasis on assessment and evaluation, because there is absolutely no way you know if your strategies are working if you cannot evaluate. It's impossible, right? Absolutely impossible. So once you have collected your data, once you've collected your data, once you've identified the risk factors and protective factors, you've developed and tested prevention strategies, either you are reinventing or you're creating a new one, then it is time for you to actually disseminate, implement, and evaluate. All right? Disseminate, implement, and evaluate. All right? So, in summary, violence of any kind is a public health issue. It affects the families, affects the health of people, all right? It's a public health issue. The public health approach must be multidisciplinary and strategic. So, for example, an health educator alone is not able to communicate the needs of someone who has been sexually assaulted. All right. So it is multidisciplinary. You have the place for therapists, you have the place for educators, you have the place for advocacy. All right. You have the place for the clinicians and things like that. So it is multidisciplinary and it must be strategic. There must be a plan. All right. There must be a plan. There must be a referral plan. You're going to a school, you go into the community and you educate some people, all right? And after your education session, people walk up to you in confidentiality and tell you about their problems. Then what do? What is the plan for referral? What is the plan to get them extra help? And this is where the multidisciplinary facet comes in, all right? You have to be able to refer them, give them the right resources that they need, all right? And put them in the right direction. So violence isn't restricted to any gender. Uh, the male gender, they engage in violence. The female gender, they engage in violence. It is not specific to any group. You can look at the data and be like, oh, the male gender perpetuates more violence than the female gender. That is possible. And that might be specific to some kind of violence. However, violence is not necessarily gender based. Some are gender specific, some are gender based, but any gender can actually be the one putting out the violence and victim and things like that. All right. So the different kinds of violence in the society requires different methods of prevention. All right. So a sexual assault is different from a gun violence. An elderly assault is different from a child violence. All right. So different strokes for different folks. All right. So the different kinds of violence requires different kinds of prevention, needs a different kind of intervention. And of course, in the next series on public health and violence prevention, this is what we will be looking at. I hope you've learned something. If you have questions, the comment box is right there. My email is also on the YouTube channel. Please email me and we will do just fine to put answers to these questions. All right. So, gracias, amigos. Thank you so much. And I will see you again on the very next episode. All right. Have a good one.